Hello, I'm Stuart English and I'm Associate Professor of Design Innovation at Northumbria University. And with me is my colleague Rafiq El-Manzi, who's an expert in the impact of design on adherence in self-administered health tech.
Hi.
At Northumbria, we consider innovation as a consequence of how we think about a problem or a situation. And so a lot of our work is about understanding a problem or situation from different perspectives simultaneously and building a very complex understanding of that. We look at a problem from a business perspective and from a technical perspective, but the critical thing that we do is we consider the human perspective. So, what is important about people's lives, and how do we balance people's needs with those technical and business needs? We recognise that there are greater and greater demands being placed on our health services. So we are, as a society, we are living longer, we're developing more chronic illnesses, and this is putting more and more stress on health services that are traditionally clinician based. And so our research really focuses on the way that we can develop a person or patient-centered um, clinical interventions in a way that can be delivered through a self-administered process. So rather than patients having to go into hospital, or perhaps as well as patients go into hospital, patients are empowered through technologies that can be administered by themselves. A good example of this might be the Polyphotonics Noctura 400. The Noctura 400 is a treatment for diabetic eye disease, and the current treatments that exist are either injections into the eye, which are both invasive and expensive, or laser treatment, which gradually burns away the retina. Both of these are clinically administered treatments and are very expensive. The Polyphotonics Noctura 400 is a self-administered treatment. It's essentially a sleep mask that prevents the eye from dark adapting. And in doing so, it allows the eye to build healthy vessels rather than leaky vessels, which will send you blind. And so what this product does is shift the emphasis from, or shift the responsibility from the clinician to the patient. It's up to the patient to wear the mask overnight. Although the device collects information about how the patient has used the product, and that information is shared with the clinician. So the clinician can monitor the way that the patient is using the product, but it is really down to the patient to treat themselves effectively. What are the influences that allow them to adhere to the treatment regime, and how can we manage those influences in order to develop more effective healthcare products? This is particularly the focus of Rafiq's research, and I don't know if you'd like to add a little bit more to that, Rafiq.
Hi. The nature of design thinking is appreciating the complexity of the situation and explore possible solutions with focus on human needs. This approach promotes it to become an innovative method to address the current challenges in the healthcare, including increasing costs, lack of resources, and staff. Self-administered treatment can provide a relief for the NHS by empowering patients to take control or partial control of their own treatment, especially with the medical technology innovation such as Noctura 400. However, adherence stands at the top of the challenges of this new paradigm. We at Northumbria University understand the complexity of adherence. Our research aims to improve adherence in medical technology innovation. Currently, we apply this approach with our postgraduate students to limit the spread of COVID-19 in collaboration with the AHS and CBI.
So this research into adherence is now informing a postgraduate student project with the Royal Victoria Infirmary and with the Academic Health Science Network. And this project aims to develop interventions that will potentially limit the spread of coronavirus. So if you are at all interested in that, please get in touch with us, either myself, Stuart English, or Rafiq Al-Manzi, and we'd be delighted to hear from you. Thank you.